I'm from Poland originally, and now I'm living in Guilford, Connecticut.
Tremendous. And what's your background?
When you're asking about my education, my background is in physical therapy. I have a major degree at that from Collegium Medicum University in Poland.
And tell us about what you do for Associated Medical and Surgery Pro.
Well, that will be complicated. I'm doing a lot of things. Right now, my position is as a patient care manager. I'm taking care of patients and bringing them the equipment to their houses for them to get ready before the surgery, to know what they can expect after. So they'll be prepared after coming home that they can start using the machines, the therapy. Or what's motivating me to work here is the response from the patients, how we as the company and me as the patient care manager that can help them, it's how they're recovering from the surgery while using us and our equipment after the surgery during their recovery. It's a tremendous help for them. It's helping our equipment is helping them reduce the pain, and it's helping them to recover faster. So getting the feedback from the patients is probably the best thing that I can get from the patients, and it's motivating me to work better.
Why are you passionate about patient care?
I like to help people. I love helping people, and I think that I love people generally. That I always want to do something that's a little bit creative and something that will make a difference in person's life.
It sounds like orthopedic surgery, which really is your specialty, is increasing. There's more and more people going through these surgeries.
That's true.
Why do you think that there are more surgeries happening today?
I would say different ages is different reasons. The first thing is we are living a little bit longer. We want to have a better quality of life. So instead of trying to deal with the pain in your knee, it's probably better to fix it because you still want to be active and go places and go with your grandchildren somewhere. So people are deciding to have a surgery. For younger population, there's a lot of sports happening, more organized sports, that when kids are exercising just one part of their muscles, the other part are not as strong. So it might be your body is kind of out of balance, and this is why the injuries are happening. And then there's a lot of people now that they're 40 and 50 and then want to keep up with their kids, and they're still playing soccer, they're still playing football with their friends and trying to be active. Some people are coaches and want to keep up with their sports. And then there's also one group of people that are not really moving much and they're not really active. And then suddenly they're going to do some cleanup in their yard, and they're lifting something heavy, they're tripping over something, and they're ending up with injuries.
So does psychology make a big difference in recovering? Can you tell us a little bit about your experiences?
Definitely, psychology makes a big difference in the recovery. So the patient approach to their recovery and how they are seeing themselves after the surgery makes a big difference. That is also why it's good to get some research before and what to expect. If you're expecting to have a normal life after a shoulder surgery and not understanding that you will have a lot of limitations, you'll probably be a little bit upset, depressed, and don't want to move at all because you're not able to do a lot of things. So it's important to get ready for it's happening. It doesn't mean that you can't have the surgery or it's not good for you. It's just better to be ready. And your body might be looking a little bit different after having a knee surgery. You'll have some scar, your knee will be swollen, you'll have trouble moving. So preparing for all of that and having positive attitude going through the physical therapy, understanding that will be difficult in the beginning, but seeing the goals, it's really important. If you'll give up in the beginning and it's like, I will be always this way, my range of motion will be 30% of the flexion and I won't be able to walk or sit down or get up from the chair, well, it is making a difference with how you're approaching physical therapy, recovery, and seeing your goals. So yes, the mental health is really important to have a good recovery.
Tell us about the importance of physical therapy. Your experiences. How does physical therapy help people recover from surgery or injury?
I think that the most important part is they are motivating you to do a little bit more than you think you're capable of. If you can imagine yourself after a surgery, knee, hip, shoulder, and the doctor is saying you should be exercising. If you're at home even after 4 weeks of your surgery, you're playing, no, I probably shouldn't be doing it. So they're guiding you on how to exercise. And then if they're scheduling the meeting, the appointments 3 times a week that you need to go, and you're spending there between an hour and 2, and they're working with you, well, if you wouldn't be going there, you probably wouldn't be doing much. So it's avoiding having too much of the scar tissue, it's avoiding locking your elbow, knee, and then you are not able to walk on this knee because it doesn't bend. So all those things are important. And then that's probably the most important things. And then obviously with the guidance, you can have a little bit better recovery. You're not overdoing stuff, and some people are. So the guidance is really important. What kind of exercise you're able to do, what are the best methods. They have all the equipment that's necessary for your better recovery. You're probably not having a swimming pool that you can use 3 times a week in winter to exercise better and easier, and start slowly with your knees after your tall knee surgery. So they have a lot of equipment that can help you with that and speed up the recovery, or make it more appropriate for the condition that you have, the type of surgery that you had, and it's helping.
How would you evaluate which product? Do you get the product that the provider prescribes to you, or should you do any of your own research?
Well, I'm the person that always likes to do some research, so I would check what the doctor is prescribing for me and what are other things on the market that they're doing about the same thing, and there's a lot of devices there. One, how the device looks, if it is heavy, how I can get one, how is the company, probably do some background check on the companies that they're providing those. There is a lot of people talking about the surgeries. If they're not talking about the devices, if you ask them the question, they'll probably either say yes, they were really happy with the company, or say no, I really didn't have any support. And that's important, because if there is any problems, you can always call them and get a response. That's very important. If something is not working or you forgot something, remember, you just had the surgery. So it's very difficult to remember everything the doctor gave you. Probably about 10 pages worth of documents that you need to follow, how many times you need to get the medication, how to take care of your wound, what exercises you can do, what you can't do, if you should be laying down, sitting down, legs up, down, all those things. And then on top of that, you need to see, you might have the immobilizer, the brace, you might have the compression device, there is some TENS units, all of that. So it is really important to have the good support from the company. So
what is a DVT?
DVT stands for deep veins thrombosis, and most of the patients would hear or remember and understand as blood clots. Most of the doctors are really concerned about blood clots after major surgeries. That might not be exactly accurate. Blood clot can happen with meniscectomy or when you have an ACL repair. So that's something to think about. And what's happening is that after a surgery is a trauma to the patient body, and the blood is getting a little bit thicker to trying to close the wound and heal. And two, patients are not moving as much, so the blood flow is not as good as normally it would be. So when you think about blood going through the veins up to the heart, the veins has a little bit of the valves to push the blood a little bit, and blood clots can happen around those valves. So if you're not moving around much, having a surgery, and having some other risk factors like smoking cigarettes, birth control pills, being obese, all those things can make the risk of blood clots higher for the patient. So that's really something that as a patient you should think about.
Can you tell me a little bit about pain management following a surgery?
There is a lot of downsides to the medication that the doctors are not really talking, or not even that, it's a lot of side effects that when you're thinking about the surgery, the side effects are not so bad, you're trying to get rid of the pain. But not every patient is looking at that this way. If you feel that you need to scratch yourself all the time, you feel that everything is itching, you're constipated for a week, all those side effects are very important. You might be throwing up, you might feel nauseous, especially just after surgery. It might prolong your stay in the recovery room from 2 hours. Sometimes it can be that they need to transport you to the hospital and stay overnight because they can stabilize you, and they can manage the pain and the nauseous. So there's a lot of things that it's good to think and be prepared for. There's different kinds of medication. Some doctors have just a few favorite ones. If you know that, or you had the surgery before, and you know that you're getting nauseous no matter what, they might give you something different. There is some nauseous rescue that can help you. There is some equipment that can help you reduce the pain. There is an option of ice. There are some other things that are probably a little bit better than ice, so it will help you with the pain. And then it's always good to see how long you should be on the pain medication. There's not much talk about being depending or getting dependent on the pain medication, so there should be an idea how long it is good, or it's you can be on it. The different people are reacting different, but if the doctor is prescribing pain medication for 6 months to a year and he's okay with that, with the same dosage, well, you probably should take care of that too and research if that's okay for you health-wise, if it's not causing any dependency, because that can be dangerous.
If I wanted to learn more about your work or about your company, how would I do that?
Well, the best way to do it, you can check us out on the website. Go to surgerypro.com. You can go to associatedmedical.com. We have a Facebook account. You can check us there. We have Twitter account. You can check us there. Probably the easiest way to do it is go to the website, and then it can direct you from there. We have a lot of content that you can see, and it will help you learn a little bit about the surgery, prepare you for the surgery. You can ask us some questions, and we'll be happy to answer. Thank you.